Perfect. So, Sophie, did you want to just open us up?
Sure. So again, thank you. It's been great to be here with you today. And thank you so much to Amanda for sharing the report. I really want to echo some of the comments in the chat. Although I am not a Family Spirit affiliate, I have to say that the data did really resonate with what we've been experiencing out here as well. So just echoing what Elizabeth said, it's very affirming to know that folks all across the country have been going through these same experiences. Next slide. Okay, perfect. So we are going to be presenting on a few things. First, we're going to touch on where we are with COVID now. So what about current case trends? What about current vaccines and vaccination trends? Dee is going to walk us through some of the updated CDC guidelines and talk about, what that really means for, the Family Spirit program, what that means for you as affiliates and folks all across the nation. Then we're going to jump into a little game targeted to help us all understand herd immunity and why vaccines are so important. The next element will be to segue into a new Center for American Indian Health mental health resource we've been working on. And that is sort of a psychological first aid guide for essential workers, which you all are working in Indigenous communities. And the psychological first aid guide both aims to help you as essential workers cope with the stresses of the pandemic, but also aims to help you help those that you serve in your communities. And then finally, Sarah is going to launch us into an FAQ section, and we're going to touch on some of the most burning questions with regards to COVID-19. After the FAQ section, we will have some time to talk about your questions. So maybe in the back of your mind as you're listening to the presentation, just think about, things that you would like to ask, and then feel free to drop them in the chat at any time. As Tara said, this is a really informal presentation, so please feel free to unmute yourself at any time and, either just speak up with your questions or drop them in the chat, and we will be monitoring during our presentation. And with that, I will hand it off to Dee.
Thank you, Sophie. And like you said, if you have any questions, feel free to speak up and unmute, or you can put them in the chat and we'll try to monitor that. So first we'll start with where are we now, COVID-19 cases. Here to the left, there's a graph of all regions in the United States, and it starts out last March. So last March is when we really started to see our first cases of COVID-19. And then you can see how they've changed throughout the pandemic. We had the highest cases in this area between October and January. And but now we're seeing a decline, and it's not quite a plateau right now. In some areas, cases are rising, but they're much lower than they were, 4 months ago, which is really exciting. But there's still a lot of work to be done. And so here's just an example of my state. And here's what the cases look like there. As you can see, the similar trends here, they went really high, and then they're now dropping off. And you can see at the little tail end right here, it's actually decreasing. So that's really good. That's not the case for every state in the United States, but here's what Montana looks like, for example. In Montana, it kind of dropped, but their averages are starting to creep up just slightly. But so it's really important that we try to continue to follow CDC guidelines, precautions, encourage vaccination, and increase access to vaccination as much as we can. So in short, cases are much lower than they were, but we're not quite out of the weeds yet. Here is where we are with vaccines. So this is from the New York Times. It's a coronavirus vaccine tracker, and they update this pretty regularly, so you can follow it, and there's a link here at the bottom. But this is as of April 11th where we are. And so we started out with 50 vaccines that were in phase 1. 4 have been abandoned. 8 have been approved for full use. None of those are approved in the United States right now. We're in this area right here where it says 5 authorized vaccines in early or limited use. So we have 3 of those in the United States, and those are Pfizer, Moderna, and Johnson & Johnson. And this is just a table that it just compares the vaccines by type. And so Pfizer and Moderna are mRNA vaccines. Johnson & Johnson is an adenovirus vector vaccine, and that's just type can also be replaced with platform. You may have heard of vaccine platform in the news or something. That's just what it's referring to. Here we can compare their effectiveness, the number of doses, days between doses, the ages that the vaccines are available for, and then their temperature storage. Pfizer and Moderna have to be stored at pretty cold temps. You may have heard some news about Johnson & Johnson in the news lately, and in regards to blood clots, and they're pausing that right now due to further investigation. And so that's can be kind of scary for people who are already pretty hesitant about the safety of the COVID-19 vaccines, but the fact that people are pausing it and doing investigation is really reassuring, that we take all, I say we as if I'm the person, investigating this vaccine, but public health officials, people who are responsible for this type of stuff, take it really seriously and don't want, anyone to have increased risk or something like that. And so their NBC, I get my letters mixed up. NBC has been giving some pretty good updates on that if you want to continue to follow that story. But what's really exciting is that many natives have been vaccinated and have led the way in vaccination. And I'll show some graphs on the next slide about what that looks, where we are with vaccinations in the United States. But when surveyed about people's reasons for getting COVID-19 vaccine, the primary motivation for participants who were willing to get vaccinated was a strong sense of responsibility to protect the Native community and preserve cultural ways. And so, folks have really put kind of some of their worries, to the side, or any hesitations to protect themselves, their family, and their community. And for others, we still need to work to get to that spot. This is where we are at with vaccinations. So as of April 11th, 22% of the US population has been fully vaccinated, which is really good, but not enough. We still need a lot more folks to be vaccinated so we can reach a level of herd immunity. And Sophie will take us through a fun activity about that later. But folks have various opinions about the vaccine rollout in this country, but tribes who have had the ability to determine who their priority folks are and how best to reach them have done a really, really good job. So here's some examples here. Here's Alaska. They've done great with their COVID vaccination, and something that we hear about in my area is Navajo Nation a lot. And Navajo Nation has also done a really good job. They've fully vaccinated over 88,000 people, which is really exciting and reassuring. So now that more folks are getting vaccinated, the guidelines have changed some. And so first, we'll define a fully vaccinated person as someone who it's been more than 2 or more weeks after they've received their second dose, if they are using a 2-dose vaccine. But if it's a single-dose vaccine, then it's just more than 2 weeks after their single dose. Fully vaccinated people can visit with other family and friends indoors without wearing masks or physical distancing. They can visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing. And they can refrain from quarantine and testing following a known exposure if they're asymptomatic. So these are the updated guidelines, but we'll go over in the next couple of slides about how to contextualize this for your own family, your own community, things like that. Just because the CDC guidelines change doesn't mean our circumstances have changed. It doesn't necessarily mean that risk has decreased depending on the situation. So we'll go over some ways to kind of sort through that situation. Some other guidelines that fully vaccinated people should continue to take precautions in public, like wearing a well-fitted mask and physical distancing. They should adhere to other prevention measures when visiting with unvaccinated people who are at increased risk for severe COVID-19 disease or have an unvaccinated household member who is at increased risk for severe COVID-19 disease. They should wear masks, maintain physical distance, and practice other prevention measures when visiting with unvaccinated people from multiple households. They should still avoid medium and large-sized in-person gatherings. Definitely still get tested if experiencing COVID-19 symptoms. Folks who are fully vaccinated have a less chance of getting COVID-19, symptomatic COVID-19 and severe COVID-19, but you can still get COVID-19 and it is possible that you could transmit the virus. So if you are skeptical or you have symptoms, definitely get tested. Fully vaccinated folks should continue to follow guidance issued by individual employers. And I'll add their state and tribal guidance as well. And then they should continue to follow CDC and Health Department travel requirements and recommendations. So as I mentioned earlier, just because these guidelines have changed, just because some folks are vaccinated and maybe others aren't, doesn't mean that the situation in your community or your family has changed. And so some things to take into consideration are how COVID-19 has moved through tribal communities, multi-generational families and homes, especially when some are more at risk and also not vaccinated, other risk factors in the community, and potential for indoor crowding, depending on where you're going. It's really important to look at the vaccination rates. And then another thing that comes up or has come up pretty recently is children returning to school. So some questions to consider when engaging in any type of activity to figure out, how risky is this? Is this a safe idea? Is this something that can be done safely if it needs to be done? And some of the questions are the people I'm gathering with fully vaccinated? And if they aren't, are the most at risk for severe disease the people who are fully vaccinated? If the people who are at risk for the most severe disease are not vaccinated, you might want to reconsider gathering with those individuals. Are the people I am gathering with fully vaccinated but live with people who are not vaccinated? Maybe I'm going to go meet a friend for coffee and it's both of us are vaccinated, but they live with someone who's not vaccinated. And if they were to get infected, could transmit the virus to that person who could then potentially get severe infection. Does anyone vaccinated or unvaccinated have COVID symptoms? If people have COVID symptoms, you should definitely stay home, get tested, and follow the guidelines there. Sorry, am I fully vaccinated? Is everyone in my family fully vaccinated? Maybe I'm vaccinated, but no one else in my family is. So me engaging in certain behaviors that's okay for fully vaccinated people might put my family at a higher risk. What are my risk factors for severe COVID? What are the risk factors of people I live with or care for? What are the risk factors of my community members? All of those things are really important questions to consider. Can we keep a 6 feet distance where I'm going? Maybe you can. And the CDC actually said that schools can maintain a 3 feet distance rather than a 6 feet distance safely. And some folks feel really uncomfortable about that. And so, just try to take into context how far can you stay away from people, or if you can't, are you okay with that? Will we be outside? If not, can we increase ventilation, like open a window or put on fan, or open the window and a door, something like that? How many new people will I be with, and are they in the same household? In my family, we've been kind of hanging out with the same 5 people because we watch my nieces, but we tend to not hang out with people outside of that. And so that those people outside of those 5 would be considered new people. And then, has anyone traveled lately? So as mentioned, fully vaccinated, just to recap, fully vaccinated individuals should continue to wear a mask, make, well thought out decisions about gathering, continue to wash your hands, and maintain 6 feet distance. And until COVID rates are lower, there is a need to still follow all of those guidelines. And we know that vaccinations are very good at preventing hospitalization and deaths from COVID-19, but we're still trying to understand if vaccinated people can be asymptomatically infected and can spread the virus. And so it's really important to make sure that, we're wearing that mask and keeping that distance, so we're helping to protect other people. And the more people who are vaccinated, the fewer people will be infected and the fewer chances the virus will have to mutate. So that's really, really important, because when the virus mutates, those are the variants that we're hearing about. And sometimes those variants can cause other, unforeseen issues, or be more contagious, or cause more severe illness. And so the more that we can help to stop that, the less variants we'll have, the better protected we'll be. And I'll hand over.
Just a second. We have a question in the chat. Narita, and I'm sorry if I'm butchering your first name, writes, what if everyone over the age of 18 is fully vaccinated, but their children are gathering? So those who are not of age to be vaccinated? I think that's a really good question.
That is, and you have to, I think back to infection rates for children. We haven't really seen a lot of children hospitalized or dying from COVID-19. And so it's likely that they either will not become infected, or they will not become infected with severe infection. And so they still might be okay. That being said, they do have the ability to become infected, be asymptomatic, and transmit the virus to somebody else. And so they might transmit it to someone who might be less protected, or who might have a more severe illness. And so in those situations, it's important to take into account who will they be interacting with, who's unvaccinated, and what is their risk for severe infection or hospitalization.
Thank you, Dee. Yeah. I think that was a really good answer to this question that I also see a lot of in my community. I feel like everybody's making these really difficult weighing decisions, for the well-being and benefit of their children and families. So I really appreciate you speaking to that, and great question.
Yeah, thank you for bringing that up. And go ahead, Sophie, and we'll go over herd immunity.
Okay, so next slide. All right, so we're going to be talking about herd immunity, and this is a concept you may have been hearing about on the news and through other outlets. And so what is herd immunity? Well, herd immunity is the point at which there are enough people immune to infection, either because they are vaccinated or because they have natural immunity after having gone through a disease, to prevent people who are not immune from getting infected. This concept at first seems a little bit abstract, and let's see if we can make it illustrated a little bit with those images. So on the top, this top graphic, you can see a community, and each dot sort of represents a person who was 5% vaccinated. In this graph, you see the light gray dots are the healthy people, the dark gray dots are the vaccinated people, and the red dots are the infected people. And here you see a community at a 5% vaccinated rate. And this is just, without social distancing, without everything. And you see at 5% vaccination rate, so many people are red, so have the disease. At 30% vaccination rate, you see things start looking a little bit different because these people, so each of these dots, only have, sort of limited contacts with the other people. So all the dots around them, you can sort of start seeing how vaccinated people kind of protect from disease spread. And at 75% vaccinated rate, the protection is really good. So you see that there are certainly a few individuals who are light gray, so who have not been vaccinated, who are susceptible to the disease, but don't get the disease because they are sort of surrounded by these vaccinated people and vaccinated clusters. Clear as mud? Well, let's try to practice all of this with a herd immunity game. So next slide. So we're gonna play a game called Zoomitis. So Zoomitis, it's a highly infectious condition. It causes fatigue, dry eyes, and a really nasty case of being so over it. So in a fully susceptible population, we're gonna say that an infected person gives the disease to 2 other people. Zoomitis can be prevented with a vaccine. So next slide will walk us through the rules. So, all right, everybody who feels comfortable, please turn your camera on. If you get infected with Zoomitis, you're gonna turn your camera off. And then you're gonna call out 2 people. Oh, yes. And then you're gonna call out 2 people who you expose. So for example, I have Zoomitis. I'm gonna give it to Amanda and Tara, and then both Tara and Amanda will shout out 2 names of people whom they're gonna give Zoomitis to. During our first round, we're gonna have a scenario where 0% of folks are vaccinated, meaning that you can give Zoomitis to everybody with their camera on. The second round, 70% of folks are going to be vaccinated. And the way we're going to do this is during the first round, I am going to send private messages to all of you. And I'm going to let you know if you're vaccinated or unvaccinated. And about 70% of you guys are going to be vaccinated. The rest of y'all are going to be susceptible. If you are vaccinated, if someone calls your name, you say, oops, vaccinated, can't do anything. And you'll raise your hand. So you'll keep your camera on, right? Because you didn't get Zoomitis, but you'll raise your hand. And the way you do that is if you look at Zoom, in the bottom bar, there's like the microphone, the camera, and the very most right icon says reactions. And if you click on that, at the very bottom, there is a bar that's raise hand. So let's see everybody give a raise a hand. Yes, 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 yes. See all the hands coming. All right, everybody knows how to do it. Okay, let's all lower our hands. Oh, thank you, Sarah, for putting the rules in the chat. That is perfect. Okay, Felicia doesn't have a camera. How about Felicia? Let's see. Let's see if you, okay, Alicia and Annie don't have cameras. That's fine. We are going to do it. How about you guys raise your hands for the first round? And then when you get Zoomitis, you lower your hand. No worries to those who don't have cameras. So you're just gonna do the raise hand reaction. And then if you have, if you have Zoomitis, you're gonna turn it off. So Andrea said, can you put the rules back in the chat? Sarah just posted them. I am going to oh, yes, she just reposted them. Perfect. Okay. All right. Are you all ready? Okay. All right. So I'll be the index case, meaning I'll be the first person who has Zoomitis. And I come into your guys' community, not wearing a mask, not vaccinated, in contact with all of y'all. And I am going to give Zoomitis to Denisha and Dawn. So I'm going to turn my camera off because I was sick. And now Denisha and Dawn.
I'm going to give it to Betty and to Kathleen.
Okay, I'm going to give it to Amanda and Sasha.
Okay, I'm going to give it to Sarah and Betty.
Okay, I'm going to pass it on to Kristen Tallis and Brandy Starbird.
I'm going to give it to Winona and Emily.
I'll give it to Allison and Rosa.
I'll give it to, I thought Dee already had it, but Andrea and Marissa.
Which Andrea?
Oh, Andrea T. Did you see me take the easy way
They're
out?
both Andrea T.
I will give it to Betty and who else doesn't have their camera off?
How do you
Tara.
How do you turn the camera off?
You hit the little stop video at the bottom.
Huh?
Or if you hit stop video, the little video camera, it could be at the
Stop
top
video?
or at the bottom.
Okay, there we
There,
go.
you got it. Yep. Okay, we ain't got much left. So I'm going to give it to Jeffrey and Narita.
I will give it to Guadalupe Huerta and Michaela Figueroa.
So everyone's infected.
All right, everybody turn their cameras back on. As you can see, is everybody infected? Did everybody get Zoomitis? I feel like all of y'all already have Zoomitis. I know I have Zoomitis for sure. All right, I am just sending private messages busily to everyone. And let's see, I think we're at about 70%. So if you have received a private message from me saying that you are vaccinated, this means that in the next round, you cannot get Zoomitis. But nobody knows this, right? So if someone calls out your name, you're gonna say, vaccinated, and leave your camera on. And if you are not vaccinated, so if you have not received a private message from me, you guys still need to get your shots. So you guys are still susceptible, so you can turn your camera off. So we're gonna do this whole game again. So let's see. Who is the index? Who wants to be the index case? Who has not received a private message from me, and who would like to be the first? Oh, okay, all right. So Sarah is going to be the index case. So she has not been vaccinated. Maybe she went to a bar. Maybe she got herself exposed to Zoomitis. All right, who you're gonna give your Zoomitis to?
Yes, all right. I'm going to give my Zoomitis to Jeffrey. Is it 2 people as well? Or just one?
Yes, 2 people as well.
2,
Same
okay.
as
I'm
before.
sorry. So I'm going to give it to Jeffrey, and I'm going to give it to Marissa.
I'm vaccinated, but I don't have a raised hand.
Oh shoot. Okay. Well, in this scenario, the game theoretically stops, right? You saw how quickly that goes. Like Sarah came into contact with 2 people who are vaccinated, and she didn't give it to them. So let's let's try this again. How about we say, okay, Sarah's a real busybody. She's a real socialite. She's going out again, hitting the bars, hitting the streets, and she's going to try to give it to 2 other people.
I'm going to try. All right, I'm going to give it to Emily and Rosa.
I am vaccinated.
Same. Sorry. Spread your virus somewhere else.
Wow. Wow. Okay. All right. Let's say she's at it again. She's really determined.
Yep. Okay. I'm going to give it to Tara, and I'm going to give it to Andrea Tavina.
I'm vaccinated.
Me too.
Wow. Okay. Well, I forgot there's a page 2.
Yes,
right,
maybe look on the page 2. I may or may not have just gone through my list chronologically.
No, that's fine. All right, I'm going to give it to Jennifer Atine. I'm sorry if I'm mispronouncing your name, and Vivian Swallow.
Oh, Vivian is vaccinated. Uh-oh.
I know Jennifer does not have a mic. So if you want to put it in the chat, Jennifer, if you are vaccinated or not, and then if you are not, who you want to pick.
I can also go back on the town.
Yes, go back on the hunt. No worries, Jennifer. I know it's really difficult without a mic or video.
Okay, I am going to give it to Dawn and also to Caroline Aguilar.
Okay, then I'm going to give it to Sasha and Michaela.
I'm vaccinated.
I'm dead. Just kidding. So since I'm not vaccinated, I have to give it away, huh?
Mm-hmm.
Is Tara vaccinated and Allison vaccinated?
Allison's vaccinated.
Me too. Stop there.
All right. Well, okay. I think this is a good place to conclude our round, but did you guys see how difficult that was? And literally we were at a 70% vaccination rate, so not even that high. And we used the number 2 because this is the reproductive index for COVID-19, actually, for SARS-CoV-2, the virus that causes the novel coronavirus, or that causes COVID-19. So which means that on average, in a completely susceptible population, right? Nobody's vaccinated. One person will give COVID-19 to 2 people. And you guys saw how difficult it was for the virus to spread in an unvaccinated community, and how quickly we all got Zoomitis after just one person in our community had it. So I think this game is really fun, but it's also, really drives home the power and importance of vaccinations, and also, reducing your contacts and staying at home. I'm looking at you, Sarah, going to all those bars. Okay, so maybe we can jump back. Yes, perfect. Jumping back to the presentation. All right, now we're going to sort of segue into a whole different topic. We're going to be talking about mental health and the pandemic. So a recent CDC study showed that during late June, 40% of US adults reported struggling with mental health or substance use. 40%. And that is for US general populations. Unfortunately, their study did not include specific numbers for Native American populations. Surprise, surprise, as if that doesn't happen all the time. But I think that in our communities especially, there are some considerations in terms of our mental health. One is that has been the high disease burden of COVID-19. Many of us have lost relatives, have lost friends, and that is something that has really impacted mental health. Even just knowing, who in the community has been ill can create a huge, a really high levels of stress on families, children, and just people in general. And that is further compounded by the lack of adequate mental health services. I think, at least here in Northern California, we are really underserved when it comes to mental health providers. The loss of community members, including elders and knowledge holders, is something that really impacts, our communities and also our knowledges. And then there's also been diminished opportunities to gather safely, share food, participate in prayer or ceremony. And all of those things have really been impacting folks' mental health all across the country, but especially in our communities. Next slide. So with this background, the Center of American Indian Health mental health team has been developing a new resource in working with frontline workers in Native communities across the country. And this psychological first aid tool is about to be launched, but it aims to serve both you as frontline workers in the COVID-19 pandemic. It aims to help, people, assess and tend to their own mental health needs, but it is also a guide that sort of aims to help you give psychological first aid to the people and communities you serve. Next slide. So this new guide sort of has 4 modules. One is about you and your relatives' well-being, and then there are some tips for supportive communication and everyday interactions, specifically in, the setting where you're, either doing a home visit or seeing a patient. And then module 3 offers practical support to community members, and module 4 sort of concentrates on priority populations in our communities to help us support everyone. Next slide. All right, so I'm going to be presenting just a few highlights from this guide. And again, it will be launched soon. It's also accompanied by a training, and we hope to make that available to you, within the upcoming weeks. So caring for yourself is not only an important part of caring for you, but also for your family, friends, and community. I think, as we saw in Amanda's presentation, this pandemic has impacted probably almost every aspect of our lives at this point. And I think in our society, especially, where everybody is expected to be so productive all the time, it's sometimes really difficult to take a step back, be kind to yourself, and acknowledge and cope with all of the feelings that have come up during the pandemic, because it really has affected us all. Next slide. So supporting relatives who may be experiencing stress is so important during this time. And I think that is something that you all probably have been doing quite a bit of. And a great way you can help people harness their own tools and knowledge to manage stress is asking them, what has helped you previously when you have felt this way? What do you currently do to help yourself to feel better? So really drawing on people's experiences and what people are already doing to help them feel better in a really stressful situation. If someone can't think of any ideas, it can be helpful to suggest some ideas to help people feel better. And that can be something like, maybe doing a breathing exercise, or maybe even just suggesting that they fix themselves a pot of coffee or a tea. Next slide. So one other aspect of this guide is sort of cultivating safe and comfortable interactions. in person and in virtual communications. So communicating virtually and in person are in some ways not too different. Like before, it's really important for everyone to introduce themselves and their role, to try to be fully present with your attention, and then listen to understand, meaning, sort of picking up on those cues of the other person to sort of assess what they need while they're experiencing a stressful situation. Sometimes we want to be listened to be understood. And sometimes we want to be listened to react. So not everybody who comes to you with a problem may want your advice then and there. They might just want to vent, and that's okay. And sort of picking up on that difference is something that is so important, particularly for people who are experiencing stress. Being mindful of body language is also something really important that, may seem like it's more important in person, and it certainly is, because you can only see me from the top up, thank God, because I'm wearing a full body sweatsuit at the moment. But, body language is something that does transmit virtually. So, and what that means in a virtual communication setting is sometimes looking at the camera, which feels really weird and strange to be staring at the dock, but like that to the other person, that looks like you're looking at their eyes directly. So that's something to be sort of mindful of in virtual communication spaces. And then finally, you can incorporate your cultural values in in-person communication or virtually, being mindful, of course, that certain things aren't meant to be shared online necessarily, but if you normally start your in-person interactions with smudging or burning root or, a cultural aspect of your identity, then, you can also ask the person that you're meeting with on Zoom or in virtual spaces if that is something that they would want and benefit from. But of course, that's up to you and to how you feel comfortable and how you've been taught. So next slide. So another aspect of the psychological first aid training is on supporting relatives through listening. So listening is one of the most important components of helping folks, especially again during a time such as the pandemic where, there's really a lot going on in people's lives. And in that sense, it's really important to listen to folks and create space to share stories. That is, I think, such a basic human need too, that, I've been missing hearing people's stories. And then when someone speaks to you, it's important to affirm them by, repeating key messages to check and show your understanding. So what that can mean is, saying things like, I understand that it's really difficult for you to, be in this virtual work environment while taking care of your kids. That sounds super stressful. So sort of paraphrasing what people are telling you rather than sort of reacting like, oh no, that's terrible, rather than, passing your own judgments and letting your own judgments flow into the conversation too much. It's important and often really tricky to normalize pauses and moments of silence, especially on Zoom. Pauses and moments of silence can be awkward in person, but I feel like on Zoom it's worse because you really we don't get this feedback that we usually get when we're meeting in person. But normalizing pauses can sound something like that. You can say, it's okay, take some time to think about it, and then you can share with me whenever, or take your time. Approaching all relatives with respect, empathy, and care, and giving warm handoffs when referring to other services is extra important during those times because a lot of people just lack the traditional support systems. Okay, next slide. Okay, all right. Passing on to Sarah to go through some of the FAQs.
Sure, thank you. One thing I was also going to say about kind of being in the virtual space of checking in is that, of course, pauses are natural as we talk and as we teach. However, sometimes it is great to also just do a check-in about audio. I know that we did that at the beginning of this webinar, but people's connections go in and out. So if it seems like an unnaturally long pause, checking in about audio or reminding people like, hey, use the chat box, those can be really helpful as well, and kind of just like complement everything Sophie was just discussing. Okay, so FAQs. So we're going to run through a couple. I think we have less than 10, but good information. If there's anything.
Can I just, I'm going to pop in really quickly. So this session is scheduled to finish at 10:30 or 30 after, sorry, I'm on the West Coast. And so we weren't able to get to our panelists, which is totally fine. But if you want to stay on, and depending on how many folks are able to stay with us, we will continue through the remainder of the session. But just please know that you're welcome to stay, but if you have to hop off due to time, that's totally fine.
Yes, and we will also be sharing the recording and the PDF of the slide deck that does include the description of how to play Zoomitis if you have other people asking how herd immunity works. Okay, we're going to go through FAQ now. If you have questions that we do not address, or you just have questions as I'm speaking and you want to put them in the chat, please feel free. I'm not very good at presenting and also looking at the chat at the same time, but we will get to those chat questions. Okay, great. So the first one is this has been can vaccines, cause SARS-CoV-2 or cause COVID-19? We've been receiving this question since, this whole time that we've been in a vaccine space, but also far more heavily since about January. And so the simple answer is no, right? So the vaccines are made from pieces of the virus, not the whole virus. A really easy way to think about this is thinking about the parts of our vehicle, right? So if you have your tires or you have your steering wheel, and that's it, that's all you have, you don't have your truck. Like that's just that you're not going to be able to get anywhere. Similarly, with the pieces of SARS-CoV-2, as they've been kind of broken apart and integrated into the vaccine space, they are not themselves the virus. So the vaccines cannot cause the virus. Okay, question number 2. Will mRNA vaccines change my genes? So genetic questions, especially as it pertains to indigenous or native nation spaces, have been very, very highly sought out to have the answers to for a very large swath of reasons. And simply put, mRNA is not the same as DNA, and it cannot combine with DNA to change our own genetic code. Yes, and then a complementary fact is that it really will only hang around inside a cell for about 3 days too. So that's just a little bit more on the science technical side. If someone has COVID-19 and recovered, do they even still need a vaccine? Yes, please get a vaccine. If vaccines are eligible to you or others that have had COVID-19, either a confirmed positive test or symptoms, right? We had plenty of people that had symptoms prior to us knowing that we were in the pandemic, right? Everyone that is eligible for a vaccine, please get a vaccine. Again, it is your personal choice, but I will sit here and say, please get a vaccine. Okay, next question. Variants. All right, so variants are slight mutations of the SARS-CoV-2 pathogen. And I think that's the right word. Sophie, if I say anything wrong, please. Okay, great. So they can affect the effectiveness of vaccines. However, our current COVID vaccines that are in existence will, help us head towards herd immunity, and also will likely over time, decrease these variants from gaining, exposure. Something that is also important to note that isn't on the slide deck is we do have a couple of confirmed variants in the southwestern United States right now within tribal regions. I'm not sure, I personally haven't seen news reportings of variants in other tribal lands. However, we have plenty of Indigenous people living in urban areas, and we have seen variants reported in urban areas. So again, as mentioned, getting the current COVID vaccines is yet another tool to continue to protect against variants. If you all need more technical information on variants or have community members, participants seeking that, please feel free to reach out to us. Our emails will be at the very end of this and also can be put in the box. Okay, next slide. All right, best way to protect against variants. Oh, well, there we go. So being vaccinated, and then also our evidence-based public health practices, right? So getting tested for COVID if you feel that you are experiencing symptoms, if you have family members that have expressed symptoms, remaining the 6 feet distance when around people outside of your household, using your masks, our hand hygiene, right? So that 20 seconds of thoroughly washing hands or using an alcohol-based hand sanitizer, if that is something available where you live. Yes, and then vaccination. Joyce, I saw that you turned your camera on. Do you have a question? No, okay, sorry, I didn't mean to put you on the spot. Okay, great, we can keep going. How should we communicate to increase trust in vaccines? So one of the tried and true methods is not correcting misperceptions. Yes, that's what that word is. So providing vaccine related information that is out of like pure emotion instead of factual can backfire, but also we I think, using that like empathy to try and understand where people are coming from is useful. Focusing on the disease, right? So let's talk about the disease makeup itself. And then, yes, so building trust through empathy. Yes, there's all of these different things. I think that there are many methods being used right now to try and get factual-based information out to all of our communities and just globally. And, we are seeing that as this pandemic evolves, we ourselves are working hard to remain transparent with what we do know and also communicating what we don't know, because there are things that we still cannot answer. And that is kind of how these things go, right? Okay, next slide. Is it safe to send my child back to school? So we've also been receiving a lot of questions about school reopening and what is kind of best practice right now. This really is a personal decision. It depends on where people live. We know for a fact that some schools never closed, right? Some did not have the capacity to pivot to virtual learning or, just have very limited supplies. Those schools are doing different things than those that went to virtual. Some schools are offering a hybrid. Some, have very stringent mask and testing policies in place. So kind of really understanding what your schools are communicating with you can be helpful. Yes, okay, and then I think also for what it's worth, just as a heads up, the Center for American Indian Health is also creating materials, factual materials for best practices for safe school reopening, and the Family Spirit Network will be sharing those out once they're ready to go. All right, next question. Is the vaccine safe for pregnant and or breastfeeding individuals? I cannot tell you guys how many times we get this question, and it is a very wonderful, important question for the work that we're doing. I think all these questions are, but course, we have many concerned families and participants, community members. So in the grand scheme of this vaccine conversation, vaccines are a personal choice. While I will sit here and recommend them, I recognize that some of that recommendation for me comes from my own personal decision to be vaccinated against SARS-CoV-2. All of the vaccines currently out are available to pregnant and breastfeeding individuals. All of them have been administered to pregnant and breastfeeding individuals. However, the vaccines that have been administered to pregnant and breastfeeding individuals is going to be a significantly less percentage than the general population, right? The general population is not pregnant and breastfeeding. So we just already have that immediate distinction in the data that we're seeing of how the antibodies form, right? We are seeing that antibodies can be transmitted through breast milk, which is very, very good for protecting our youngest community members and family members. So anyways, I feel like I could just rant about this for a while. There are not currently any risks for reported risks for the vaccine for pregnant breastfeeding individuals. However, we are recommending that because this is a personal choice, people that are pregnant and breastfeeding consult with their healthcare provider. Within the Family Spirit Network, you all have the ability to make that direct referral, and healthcare workers are wanting to have these conversations. They're wanting to give, as much information as they have for people that want to know about this vaccine, or, maybe they're thinking ahead, family planning, right? Maybe they want to have a child in the next few years, and they're thinking like, what does that mean for my vaccination status and for, protecting my family presently? Yeah, is that the last question, Sophie? Yes. So I'm happy to answer, I guess my team is happy to answer more questions as they exist. I kind of went through that very quickly. Yeah, so thank you all.